Hi, I'm Joellen with Insurance Professionals, here to discuss the PPO plan option that Page One Power is offering. This one also has a network requirement, and it's the aetna.com/ASA to look up your providers in network. This is a copay plan, so it has a individual deductible of $2,000, and there's 2 individual deductibles per family. It's not a combined deductible like the HSA, and the deductibles are double out of network. So it's very important to make sure that your provider is in network. The deductible is going to apply for most of your major services. Once you meet that $2,000 deductible as an individual, the insurance company is going to pay 70% and you will pay 30% until you reach a total out of pocket of $6,600. And that's double for a family. Preventive care services on this plan as well are covered at 100%. No copays, no deductibles. Just make sure that your physician codes it as a preventive screening. Physician specialist office visits are covered under a copay. That means that when you go to the doctor, all you have to pay is $30. And that covers the charges in that office visit up to 100%. And the covered charges include the in-network office visit itself, non-surgical injections, allergy injections performed at the same office, and billed by the attending physician or specialist. If you go out of network, you will pay deductible and 50% coinsurance. So it's very important to use an in-network provider. Outpatient diagnostic x-ray and lab benefit. You have up to $250 that's going to be covered at 100% by the insurance company. Any charges after that would be subject to deductible and coinsurance. The covered charges for the diagnostic x-ray and lab benefit include x-rays, lab, pathology, and radiology services. It does not cover under that benefit any CAT scans, MRI scans, PET scans, or SPECT scans. You also have an outpatient diagnostic imaging services, which does include the CTs, MRIs, and PET scans. That is applied towards your deductible and the 70% coinsurance. This plan also has a lab card program. If you're going to exceed the outpatient diagnostic x-ray and lab benefit, if you use a Quest diagnostic service, then those charges are going to be covered at 100%. The prescription drug card benefit, you have a generic copay of $15. You have a $100 deductible for preferred or non-preferred prescriptions. And after you meet that $100 deductible for preferred or non-preferred prescriptions, you're going to be paying $45 copay for preferred or a $75 copay for non-preferred. And that is at the retail counter. You have an option of paying for a 90-day supply for your maintenance drugs, which will get you a $30 copay for your generics, $110 copay for your preferred name brand, and a $225 copay for your non-preferred. So it's a little bit of savings if you do the mail order program. There is a phone app that we have available for that, that you'll be able to scan your prescriptions and order your prescriptions and follow up on them. And I'll give you that information later. When members choose a brand name drug, when a generic is available, the members must pay the generic copay plus the difference in charges between the generic and brand name drug. And why we do that is the generic drugs have always been they used to be a preferred brand name drug. They've just gone off of their patents. So they typically work just as well as name brand drugs, and it becomes your choice to use a name brand drug. Okay. Inpatient hospitalization and outpatient surgery access. There is a $500 access fee per hospital admission or $500 access fee per outpatient services for surgery. This $500 does apply towards your out-of-pocket maximum. It does not apply towards your deductible. Inpatient hospitalization is your deductible of $2,000 and your coinsurance of 70% until you reach your out-of-pocket maximum. Outpatient surgery is the same. You do have an office visit copay for urgent care visits. Urgent care visits are $75 copay. It covers 100% of the charges during that urgent care visit. Emergency room visits have a $250 copay. Covered charges are paid at 100% after you pay that $250 copay. Those charges include physician and facility charges and services related to while a patient is in the emergency room. You do have a chiropractic manipulative therapy benefit. You're allowed 20 visits per calendar year with a $30 copay. Your outpatient or occupational speech and physical therapies, you're allowed 60 visits per therapy per calendar year, and that is applied towards your deductible and coinsurance. You're allowed acupuncture, massage therapy, and naturopathic medicine up to 12 visits per calendar year. That is applied towards your deductible and coinsurance. There is nutritional counseling, which allows you 3 visits, and the plan does not limit any diabetic counseling, and that is deductible and coinsurance. There is non-dental treatment of temporomandibular joint dysfunction, which is called TMJ, and that is applied towards your deductible and coinsurance. There is a chronic pain benefit of 10 visits per calendar year, and that is applied towards your deductible and coinsurance. Mental illness, nervous disorders, substance abuse, and alcohol abuse are covered same as any illness on this plan, so it's going to apply towards your deductible of $2,000, and then the insurance company is going to pay 70%. Let's see. Prosthetics, durable medical equipment, private duty nursing care, skilled nursing care is limited to 81 visits per year. Home health care, 100 days per calendar year, and hospice care, 6 months while covered under this plan. All of those services are applied towards your plan deductible and your coinsurance, up to your out-of-pocket maximum. Ambulance services are applied towards your deductible and out-of-pocket maximum. Organ transplants are at a designated facility, covered at 100% after your deductible, and at a non-designated transplant facility, your deductible and coinsurance as well. This plan does require pre-certification for inpatient rehabilitation, skilled nursing admissions, behavioral health, residential treatment, and hospice care, and outpatient high-tech imaging services. There's a $300 penalty for not pre-authorizing. Please make sure that your primary care physician or your specialist is making sure that you get pre-authorized for those benefits. There is no lifetime maximum for the essential health benefits as defined by the Affordable Care Act. And you do have a new program on this called Teladoc. The Teladoc program gives you 24/7, 365 days a year access to U.S. board certified doctors through the convenience of a video consultation for non-emergency assistance to treat common medical conditions. The Teladoc operates subject to Idaho state regulations, and it's a $30 copay to use the Teladoc services. This plan also covers domestic coverage if that's a family need.